Hi, Marcy. I'm so excited to have you on the Fringe podcast. Welcome.
Thank you. Thank you. I always love talking with you all. So I'm so excited to be here.
So I wanted to start off kind of at the beginning,
Mhm.
beginning for you in life.
Mm.
What led you to be a pelvic health physiotherapist? Like, it's not something I know for myself
Yeah.
as a young girl. It's not something that I knew of or dreamt of being. Um, and I'm so curious, like, how did you get to where you are now?
Yeah. So I think it was kind of the same. I didn't know really anything about the pelvic floor, women's health. I didn't really know there was a niche for that in physical therapy. And going into PT school, I kind of like, I think other people wanted to do sports and, like orthopedics and kind of like the sexy part of PT and like, stretching athletes and like, all these things. Even though I'm like the most uncoordinated person ever and like never played sports with balls. So I'm just like, what is going on? And I was young-ish. I mean, young compared now, but I guess old compared to a lot of my classmates. But I had just gotten married. I was like 25, and not I was not like in the kid world. Like none of my friends were having kids. Like it just wasn't even on my radar. So I didn't even really think. Like I just wasn't even thinking about pregnancy and postpartum and this like life phase. And I had worked in orthopedics, cardiac rehab, lots of stuff before going to PT school. And I kind of was like a little disenchanted with the model. I felt like I wanted more with my patients. I wanted a little bit more time. I wanted a little bit more one on one connection with them. And so I thought I made a big mistake when I was in grad school. I was like, "Oh my god, like this I picked the wrong profession. Like this is not what I thought it would be." And one of our first anatomy classes in our first year, they like front load it. So we were kind of at towards the end of anatomy and the professor that was teaching the spine section put up a picture of the pelvic floor. And she mentioned that there are physical therapists that like work in this area and that women when they have like babies will tear. And I was just like, what? And I was sitting in the front row. I'll never forget it. And it was like one of those moments like my jaw hit the ground and I was like, wait, you tear when you have a baby? What do you tear? What are we talking about? Like this was like
New,
completely
new information,
yeah,
right? Yeah.
completely new information.
Yeah,
Like
light
I
bulb moment.
zero previous knowledge of anything. And I was like, "What are you talking about?" And then she kind of went on and said, there's all this dysfunction that can happen afterwards and physical therapists can work in this area, and blah blah blah. And I just was like, whoa. So I got really interested in this kind of path. And in grad school you have to do generalist tracks, right? But I tried to get as many rotations and exposure as I could to women's health, pelvic floor, pregnancy. There wasn't a lot back then. Like it was a while ago and there really wasn't, but I got very involved with the American Physical Therapy Association as a student. I was, like, presenting at, CSM, which is, like, the big combined sections meeting as a student, kind of, like, really trying to just, like, get my fingers into a bunch of stuff. Loved it, really, just kind of felt that vaginas, like, aren't weird to me, and, like so I'm like, "Vaginas aren't weird to me, I really feel like I should do this."
Yeah.
Like, don't ask me to, like, pack a wound or do, like, percussion on somebody on the vent, but, like, I will happily put my finger in any anus or vagina out there. So, I'm like, "Ooh, this is great," and, like, match made in heaven. So, I just really loved it. I really fell in love with, the patient population, the complexity of the diagnoses, the injury prevention side, which is kind of like where I've shifted over the last decade, and which I really love and is exciting for me. I love the connection with patients. I love that it's underserved. I feel very strongly that, we do a really crappy job at caring for women. And so I just loved it, and I did residency after I graduated to get a little bit more exposure, mentorship, back in the cadaver lab, teaching a bit, and then I was fortunate enough to work for some really amazing clinicians early on in my career, and I just was never had to compromise, like, my setting. Like, I was always given an opportunity to do women's health without having to do, like, other things, like sports or ortho or cardiac, like, so
So you
that was
didn't do,
yeah.
you didn't do ortho, like, at, like, it was right from the get-go in school that you had this moment of kind of clarity saying, "Okay, wait a minute, this is something I wanna,
Mhm,
like, specialize in."
mhm.
That's so cool. Yeah, really
Yeah,
cool.
and, like, back in the day, like, pelvic floor and women's health really wasn't part of the curriculum, especially at,
Mhm.
where I was in Los Angeles, it really wasn't, and, the APTA had it was called the Section on Women's Health at that time, now it's the Academy of Pelvic Health, and they had the pelvic floor courses and, like, the OB courses, but they didn't really let students in them, now you can. But my 3rd year, when we have our big rotation, so the way that my school did it was they split the class up in half, and half of us went out for full-time clinic for the 1st semester, and then the other half stayed, did part-time clinic 3 days a week, and then was in, um, the classroom, and then we swapped. So I found a clinic in Pasadena, outside of Los Angeles, where I was, and the woman there, Laura Horn, she did women's health and Pilates and pregnancy and postpartum, and she taught me the exam. She was like, "Yeah, I'll take you." And I had no experience, like very limited exposure in grad school. And like she taught me just a basic rudimentary exam. We did a lot of musculoskeletal postpartum, kind of vanilla pelvic floor stuff, like stress incontinence, like pain after having a baby, like nothing super complex.
Yeah,
But
but
I
that's great. You got the 101 on pelvic health kind of right out of the gates, right?
Yeah, and
So
I think that
awesome.
was, like, a very unique situation, and I had to do the exam I worked on her pelvic floor for weeks before she let me, do any patient care, but, I think nowadays that's, like, pretty rare. I think we can students can take a pelvic floor 1 course, they have a little bit more exposure in school, but I felt like I kinda had to, do it find it myself, and I just these people were kinda put in my path very advantageously, and I think that really helped me, like, focus in on this particular niche.
For sure. So what about the down there doc? How'd
Yeah.
that's come about? I mean, it's not a name that many would have chosen, and I love it. And you obviously have a new app as
Mhm.
well.
Yep,
So,
yep.
like, yay, good for you on that, right?
Yeah.
But how did that come about?
So, when I was let's see, we moved back to Los Angeles in 2018. My youngest was, like, just about to turn 1, and I had a clinic I opened up a clinic in LA, and I was working part-time when my kids were little, and I was a solo practitioner there, and the experience that I had had in the past and at that time, as you know, like, you're only one person, right? And you can only see so many people a day, and you only have so many hours of patient care, and you're limited by time and geography and money, and, one set of hands can only do so much. And at the time, like, social media was, like, pretty new. Like, I think Instagram had just been bought by Facebook. I mean, they didn't even have there weren't videos. It was all still pictures. Like, it was a newer modality, I guess, newer kind of platform. And I had wanted to do some content online with the goal of, like, reaching a wider audience because I did have people come in from out of town. They would fly in, stay in a hotel for 5 days. I'd see them, 5 days in a row, 2 hours, send them home, communicate with their care team at home, and, that's just not, like, feasible for a lot of people, right? And so I didn't want there to be all of these barriers to care, which I feel very strongly should be standard. Um, so like how can I reach more people with the same type of information and how will it translate over from like in clinic work to video or whatever. So I had wanted to do some of that back in LA. Um, at the time I was married and my husband still is a collegiate coach. And so we moved a lot. And I wanted to also create something where I could work and provide, but not have to like close a clinic every 2 years, 3 years, because we moved a lot. And as you know, like building a caseload and signing a lease on the space. And it's like, that's hard to do if you have to move and close every 2 years,
That's
right? So
actually
it's
almost
like,
impossible,
yeah,
right? Like,
yeah,
it does take a lot of energy to build a practice, and then you've developed relationships. You don't want to just sort of peace out and move on. So, okay.
yeah.
Okay,
And
continue, continue.
yep, and it's oftentimes, like, very last minute and unplanned. I had young children, and it's tough. Like, it's tough. So, I wanted something that would allow me to be flexible and also have the goal of, like, reaching more people. So when he got the job here in the South where I am now, that was around 2020. So I closed my clinic, moved here, and I was like, okay, this is like the time to do the video stuff because we just moved. I don't have a clinic. I'm not working right now, etc. My kids will be like daycare. This is great. I can like really focus on building this up. COVID happened. Like the week that we moved here. Like we came that Wednesday in March. It was like during spring break here for Auburn. And then, like, nobody came back on Sunday. And we got out of LA that Wednesday. LA basically shut down on Sunday. And then we were here in an Airbnb for 8 weeks with none of our stuff. My kids that were supposed to be in, like, preschool and
Childcare. Yeah.
0. No toys, nothing,
Marcy, this sounds like a nightmare. I'm
nothing.
sorry, it
I
does.
mean, yep, like, because they were supposed to be in school. So,
Mhm.
like, we had to wait for our like, clothes on the house. So I was like, "Oh, yeah, we don't, like, need anything." Like, they'll be in school. I had my car. I was, like, waiting for my car that was shipped with, like, their scooters in them. Was in a new city, new state.
Yeah,
My
you did
family's
not
house
plan on
here.
a pandemic, essentially.
Yeah. Yeah, exactly. And so I was like, "Okay, well, what do we do?" Like, okay. So we kind of get through the first couple months and then we move into the house and then I'm like not working because clinics are closed and I'm new to the area. I don't even think I have my Alabama PT license. Like I'm not doing any of that. And I had started my Instagram with the Down There Doc name back in Los Angeles and I was just posting like some content and some clinic stuff and just kind of information. So when we got into the house, I was like, all right, well, this is the time. Like I don't know what I'm doing. I have no idea what I'm doing, but at like 3 in the morning when the kids were asleep at night, I would set up my phone and like just record. And it was so bad. I mean, horrible. Like my dog is like in the background, like licking her vulva, and there's like, airplanes, and it
But this
just,
this was the pandemic. I feel like this was actually totally acceptable as well
girl,
during a pandemic.
yes.
I remember
I
my children,
mean,
I'd have them, like, bouncing on my lap or walking in the
yes.
background.
Yeah,
It was a totally different time,
it
right?
was. Yes, totally different time. So that was when it kind of that started with like the first round of online courses. And then I kind of did that full time for a while, trying to get that off the ground, filmed, just like bootstrapping everything. And then went back into the clinic and then kind of still doing some of the down there doc stuff on the side. And it's gone through a couple like versions. And so now instead of having like an online course platform, we still have that. And that's I think what everybody was doing during COVID, like webinars and this sort of thing. Now all of the content is on the app. So you can people can still go on the computer, but like the birth prep and postpartum and all those courses and information is like within an app. So that's that. And then I opened a clinic here. So I'm like kind of blending the two.
That's awesome. I think, obviously you're bringing such a huge, I'll say, specialty to your clients with your one-on-one service, but then having the app is huge. right? For anyone that can't access you in the
Yeah,
one-to-one sort of
yeah,
environment.
the goal and the hope is that it is widely accessible and that the barriers of cost, time, geography, all the things are kind of pushed away. It's
Minimize.
super affordable. It's like I need to actually like update and refilm, but I just am like, okay, I have to do. I'm like, it's such a big undertaking, and I have to like next year. That's on the docket for 2020.
One step at a time though, right? You're a busy lady. So
I
let's talk.
am a busy lady. Yes, yes.
You are, you are. Let's talk a little bit about the work that you do, because I think that so many people and maybe listeners, they even think of pelvic health physiotherapy as a little bit taboo, right? Talking about women's bodies, birth, sexuality, pain. Um, I mean, I don't, because similar to you, I'm a pelvic health physiotherapist, right? So to me, this is just stuff that we chat about, right? But what's the conversation that still surprises you? So one that you thought would be easier by now, like you're well into your career and you thought that what would you think would have been kind of just so much easier now and it's just not?
Um, yeah, I think it's a great question. I think probably getting the larger medical community on board. I think physical therapists always kind of have a little bit of an uphill battle, right? Because we aren't really seen as like an integral part of the team, like historically, right? We kind of have this like, oh, well, they're like, what's different than like a fitness trainer or a chiropractor or something like that? So, since we've had the doctorate and we are much m- more focused on outcomes and evidence and these really advanced biomechanical studies, and we're really looking at the body and movement in a different way. I think we've, kind of come out of this older way of thinking that like we're just, glorified fitness trainers, right? So I think that's always been challenging for PT in general. The women's health aspect is like brings a whole nother layer to it because of like the taboo stuff. And I would say, I would think being in the South here where it's like a little bit more hush hush, like it's a little bit more small town feel, a little bit behind the times down here, that would be even harder, but it hasn't been. And what I've noticed in my career, because I have moved around a lot and worked in different cities and states and different types of practices, is that it really doesn't matter if you're in Los Angeles or San Francisco or Portland, Oregon, or a suburb of Portland, Oregon, or a tiny little town in the South. It's all the same. Like, we all have women are dealing with the same stuff. Like, nobody knows what's going on with their pelvic floor. Nobody is, like, referring out to physical therapy. Nobody knows that it's a thing. Like, it doesn't matter even if you have access to, like, a ton of these resources. So, I would have hoped by now, 16, 17 years into my career, that this would be a little bit more common. I think we're getting there. I definitely think we're getting there, and I think as this, like, newer kind of wave of younger physicians are coming in, that they're getting exposed to pelvic floor work and physical therapy stuff in school and residency and rotations, and so I think we, as the PTs, need to keep focusing on, like, educating our colleagues, so it's not so foreign when a patient asks a question about it. And I've
Yes.
seen that just shift in the 6 years that I've been here. Like, since there's been kind of like a wave of some of the older physicians kinda, like, retiring and, like, the new ones coming in, like, that's just changed just in the last, like, 4 years.
So on that note, can you describe, because some listeners might not really even know what a pelvic health physiotherapist does. So if you like it 2 seconds or less, but like how would you describe what you do?
I mean, like
Okay, not 2 seconds, but
yeah.
some people, I have
Um,
clients that come into my practice and it's
yeah.
insane. A doctor, like their primary healthcare practitioner has referred them to pelvic health physiotherapy. And they come in to my practice and I say, okay, so this is how it's going to go. And like, I describe what we'll be doing today. And they're like, what? An internal exam? And I think to myself, wait a minute. Well, where is this disconnect? How did
Yeah.
you not know that that's what your doctor had just referred you to? And FYI, these are all your issues. How, like, where, how did you think we were going to kind of assess the situation? And so I'd love to hear, how would you describe to our audience, what do you do?
Yeah. So, as a physical therapist, our job is to help the body function in the most optimal way possible based on the demands and the needs of the body. We're really, really good at mechanics, at injury prevention, at getting somebody to a point of kind of like the highest level of function possible based on what they need to do. We're physical therapists are like the best people when we're dealing with like muscle and ligaments and soft tissue and posture and breathing and like I said before, mechanics and all of the things that like the resources that our bodies need. Like we're really good at that, right? So my kind of area, like my little like carving out part of physical therapy deals with the pelvic floor, which is the same type of structure and muscle that you would see in any other part of your body. I just happen to work below the belt a bit, like knees up, breastbone down is kind of like my area of expertise. I support the pelvic floor in any sort of function, whether we're talking like orthopedic surgery, gynecologic surgery. My kind of niche within the niche is injury prevention and preparation for delivery, just like we would prevent ACL injury in a soccer player. My focus mostly is on women through the reproductive years, both from like a pain standpoint, urinary bladder, sexual function, and just general wellness and optimal positioning of the body. So to me, vaginas are elbows, like it's the same. I just like it's a vagina.
I love it. I love it. So, that's perfect, right? But that gives people a better sense, our audience a better sense of like, what you do with this specialty and like exactly kind of where your niche is. So, have your own experiences, like as a woman, as a mother, have they changed how you practice?
Oh yeah.
Yeah, I was gonna say I know mine have, but I'd love to hear how. Like, what's something, maybe not a super personal experience, but something that has changed you?
Yeah, I think like the biggest thing for me was when I was out of residency and working for a practice in the Bay Area of California. We had decided that we wanted to my husband at the time and I decided we wanted to start a family and um I was working 40 hours a week, seeing patients pregnant, postpartum, kind of all the things and we had a very difficult time getting pregnant. Took about 5 years with IVF at 2 different locations. I had a lot of losses, like, a whole bunch of stuff. And I think that that really changed the way that I approached, um, like, the personal connection with patients and, like, the empathy component, and I was pregnant multiple times at the same time as, like, my patients were, but they would continue and then I wouldn't. And so I really had to learn how to kind of like separate out this like very powerful like experience like putting your hands on someone is like very profound, right? And so like you're in a room and we're talking about life and babies and you're helping them like get ready for this and then like I'm experiencing like an active miscarriage like during that
Oh,
time, so like
I'm
it
sorry,
really
Marcy, that does sound really challenging.
Yeah, it was right. It was
Oh,
hard, but it showed me that, like, we can still have these, like, very different experiences and still kind of, like, band together and, like, show strength and support for each other, right? And so it helped me kind of, like, separate a little bit, but also, like, understand kind of this, like, sacredness between women. The
mhm.
second piece is, like, when I actually had my boys, when I had them in Portland, I had a really tough delivery with my first, and my second was, like, he flew out. It was, like, so easy. And then being, like, a working mom and trying to, like, navigate this, like, new sense of identity and, like, opening a clinic and, like, wanting to help women and, like, really now understanding, like, the emotional labor component and, like, the anxiety around being a mom and having undiagnosed anxiety and like not being supported by the medical community, both from like infertility and then primary care. Like I was on the other side of the table and I just was like, you know what, this whole thing is like complete bullshit. Like the states, like we do so bad. So I just was like, I don't ever want to practice in a way that makes women feel the way that I felt as a patient and as somebody that was, like, actively searching for help and then just being like, you're fine." So, I started, like, less is more kinda deal with my patients. Like, I used to be very much like, "Okay, we're gonna do this, we're gonna do this, and you're gonna do this, and you're gonna do this," and then finally I was just like, "You know what? I think this is too complicated. I think we're making it way too complicated. I think we need to figure out, like, what this mom's schedule is like, what she has capacity for. If she tells me she literally has 2 minutes a day, I will make a program for 2 minutes a day, and, like, I will not shame her for that. Like, I'm not doing it. Like, I don't care. I'm not doing stick figures on paper. I'm not giving lots of handouts. Like, I will text her a 2-minute exercise program, and if she comes in and says, like, "I couldn't do it," I'd be like, "Great, totally fine. We're gonna figure something out."
Yeah,
So,
let's
like, I
pick up where we left off. Perfect,
yes.
right?
Like,
Yeah,
I'm
yeah.
I'm never gonna say somebody is non-compliant. I'm never gonna, like, not have a screaming baby in the clinic. If, like, they can't come because they don't have childcare, then, like, they bring the kids here, and if they throw up and scream and do everything on the carpet, I don't care. Like, I just, like, there are it's hard enough for women and moms. It's hard enough. Like, this is not one more thing that I want to add to, like, make it even more overwhelming. So I think, like, I didn't understand that since having kids, obviously before having kids, I just thought like, well, we can do everything, but
Well, it's
it's
hard. It's very hard to, like, truly get it unless you've had that lived experience. It is, right? And it doesn't mean that you can't help people for all the public health physiotherapists out there that don't have children or what have you. Of
oh, for
course,
sure.
you can still
Oh, yeah.
help, but
Yeah.
having that lived experience, it definitely puts different aspects of care into perspective, right? And you might approach them so differently. I mean, I know I do too, right?
Yeah, and I think too, like, the further you get in your career, the more confident you are with your skills, right? And you know what you don't know, and you know what works and what doesn't work, so you can, like, kind of figure that out, like, based on your experience, right? Like, as a new clinician, like, you don't know, so you're just like, "Shit, I'm just gonna do everything," Like, I don't know what works and doesn't when I see this and this presentation and this, so it's like, it's easy to kinda be a little bit more not lax, but a little bit more, like, flexible because you've had the experience as a clinician and you know mostly, like, what the outcomes are gonna be based on this and prognosis and your tests and all the things, so you can be a little bit like, "Okay, yeah, that's not, like, top of list, like, but this is, so let's focus on that."
Totally. So, Marcia, you've been in practice for how many years? How many years have you been practicing?
Let's see, I graduated from, PT school in 2010, so residency was 2010 to 2011. So 2010, what year is it right now? 26,
Yeah.
16?
So, yeah, like 15, 16 years. That's
Yeah.
insane. So, 15, 16 years of practice, like Marcy the mom, Marcy the practitioner, like there's lots of different, hats that you're wearing. What for you is either in practice or personal life, but what's a non-negotiable for you? What is kind of your ride or die? What, yeah, non-negotiable.
Yeah, non-negotiable. Gosh, I would say like non-negotiable for work would be like the culture and the team that I have around me. Um, and I think that that is so important and that the people that you surround yourself with and the energy that they bring is going to really shape what type of like care you're putting out there. So I'm very like kind of picky about that. I'm like, I don't want work to suck. So like you got to be cool. Like, sorry. You have to be okay with me like saying something, inappropriate every now and then. You have to be cool with me like not finishing my notes. You have to be okay with me like, being a mess sometimes. Like I'm not perfect and I don't expect you to be, but like you got to be cool. Kind of. And then I think personal life, like the non-negotiables, and it's funny that you say this because I've been doing a really bad job of it this last like month. is like taking time to really kind of ground myself with the things that I really like to do, active wise, and traveling and mental health with my friends and riding my horse and not getting so bogged down with like all the to-dos. But I haven't been great with that the last couple weeks because there's just a lot of stuff coming up. But
I
I
think you
just
could maybe be a little bit forgiving, right? You're in a transition time, you're opening up a new practice, like a new space. You've just launched an app. Like there's a lot. I always think of like balance. Everyone talks about being in
Mhm.
balance, right? Or balance. And I always think, no, no, no. The net of the highs and lows and busy and not busy and so on, the net has to be a balance. But I'm never actually in a balanced state between work, mom life, all of the things.
yeah.
So I'm just going to say, hey, wait, let's be a little bit more forgiving with that
Yeah,
non-negotiable.
I know. It's like it's like what we tell our patients all the time, right? And then like in the background, I'm like, shaming myself and feeling guilty and all the things, right? But it's like it's like you gotta, you have to go, you have to do it for sure. But yeah, I just feel like I don't think I think we have to give ourselves, like, a little bit more grace when it comes to these things too, and realize that, like, nobody can do it all, like, there is a give and take, right? Like, if you're spending more time at work, then you're not spending time doing something else. Like, if you're spending time with kids, then you're not spending time at work, and it's fine, like, it's not that one is better than the other, it's just that, like, you can't be in 10 places at once, and it's okay for something else to, like, come down, the list of priorities while you're
To
doing something.
balance it highs and lows, right? With like works here and maybe family life is lower. And oh my gosh, now we're going to go on a vacation and it completely switches. That is okay because the net is sort of, balanced or yeah, for sure. So is there something that you've had to really work on like yourself then, like say a habit or a belief? Or something that yeah, that doesn't come naturally. Like what would be something I mean, well, you've got a lot going for you, right? Well, what do you
Yeah,
work
I
on?
think yeah, I think what and in the last, like, year and a half too, like, I've done a lot of this kind of work also, to try to, like, not control everything and to try to, like, be okay with not knowing what's gonna happen all the time and, like, trusting that I will figure it out and that, like, I've gotten through everything so far, so even if the outcomes weren't, like, what I totally wanted it to be, but there's no reason why, like, I can't keep doing that even if the outcomes are not what I want, And I have to just kind of, like, let myself be okay with, like, that piece. And I'm also, like, trying to, like, say no to things.
Oh, good luck.
Which is, like, really hard.
Both. That was awesome. Yeah.
Um, so, yeah, I'm trying to, like, say no and not give, like, an explanation, you know?
Yeah.
And that's hard to do.
Mhm. That is hard. Um, I'll say good luck, but if you figure it out, can you just drop me a quick note and let me know how?
Yeah, yeah, for sure.
For
Maybe I
sure.
should ask ChatGPT, like, "How do I do this?" Exactly. Maybe so.
Totally. Okay,
Yeah.
okay, so back to more work-related stuff. That was a little, like, personal side. But you're someone who, like, clearly is willing to stand in a different corner to mainstream medicine, right? Sort of take the bull by the horns, like postpartum and prenatal care and so on. So where does this I'll say the confidence, but where does this come from? Um, is there someone professionally or personally that has helped you with this confidence? Because even you just said, you're like, "It's always worked out." I've never been able to not sort of, achieve something or that kind of that's huge. Yeah.
Yeah, that's funny that you put it that way because, like, I don't know, I feel like we all have this, like, imposter syndrome too, Like, "What's happening?" Like, they're gonna figure it out that, like, I really don't know what I'm talking about, and, like, I'm just making all this shit up, like they're
Mhm.
gonna like expose me, but I think, I mean, to be honest, like since my divorce, and I think since I went through a lot of therapy and a lot of trauma work and a lot of EMDR type therapy, like eye movement stuff. I think that's really helped rewire some of these old beliefs of anxiety and spiraling and just scrambling and like these like high trauma responses. So I don't know if they're like the confidence piece. I mean, I never really like thought about it as confidence, to be honest with you. Like you saying that is like, oh, is that what that is? Like, I don't know. It's more of me trying to be like, not, take a long walk off a short pier kind of thing. Like, it's going to be fine. Like, this is fine. Like, I've done this before. Like, it's scary and like you have no money, but it's going to be fine. It's going to be fine. Like sometimes you have to just like go. But I don't know if there's, like, a certain person or, like, a certain something. I mean, my parents have always been very supportive. They're very tough, ex-military from New England, like, not warm and fuzzy. My mom is 80 now. She was one of the first, like, women officers in the Air Force. Like, she retired as a colonel. Like, my dad went to the academy, Air Force Academy, and, like, they didn't let women in at the time. So it's like my parents are hardcore, and they've always raised my sister and I to be proud of the work that we do and to, like, not settle for bullshit. And so I think even though it's, like, a tough love kinda deal, I think they kind of, like, are like, "Yeah, you're gonna do like, if you wanna do hard things, like, you're gonna do it. And, like, it's gonna suck, and don't come crying to me about it, but, like, finish what you started." Um
Has that I'll say confidence, I'll use that word again, that your parents have instilled in you. It totally is. But has it ever really, I'll say, cost you anything professionally? Do you feel like there was something you, I'll say, missed, or yeah, that um you didn't get
I
because
think I think the problem, like the other side of that, is this feeling of like not good enough, not smart enough, imposter, I can't do it, I'm nobody, like begging and feeling like I need to prove something for like worthiness. And I think in the early parts of my career, I really felt that high level of like pressure and perfectionism to be this like to prove that I did the right thing, or that like I'm worthy of seeing patients and that like I can do it. But a lot of that like goes to like some of like the past trauma and like feeling, whatever. So um but I think we can turn that into not like a like more of just a security maybe of knowing that like, yeah, I am gonna make mistakes and I am gonna mess up, and I do all the time, every day, and I've made horrible mistakes with my business and terrible choices and decisions that have I'm still paying for today. And but it's like that is not going to define my worthiness of doing what I feel is really important to do in this work.
yeah, but through those, I'll say some of those what we're deeming mistakes, there's so much growth that's come from it, right? So I hear you though, for sure. Um, so then with your current practice, like how do you decide what's worth exploring, or a path to go down, or a product to use in your practice versus stuff that you're like, yeah, nope, not gonna recommend it. How do you make
Yeah.
these decisions? There's
Yeah.
there's so many different, I'll say products, right? But also just decisions to make around business, how many practitioners to have, what the length of your sessions should be, what is a good amount of time, or, all these different things. So
Mhm.
how do you make these decisions?
Sometimes I just have to like kind of make a decision on the fly without a lot of prep and be like, well, that worked out, or well, that didn't work out. Not going to do that one again. But I think like the bigger type of decisions regarding products and culture around the clinic and scheduling, I try to put myself on the other side of it. Like, would I use this product? Do I want a session to look like this if I was a person, like a patient? What don't I like about medical appointments and about physical therapy and about, like buying stuff? And so let's not do that and kind of see. And I ask my clients and my patients like what they want and what they like and what they don't like. And I try to create something that resonates globally. And if I won't put it in my vagina, I'm not going to recommend it. So it's like, that's that.
Yeah.
And any sort of messaging, like brand messaging, like if I am doing things with or collaborations with brands online or on social media or whatever, any sort of messaging that is not in line with the mission and vision of what I'm trying to do with the down there doc in the clinic, I will not do. Like I am very sensitive about what the brands and companies are trying to do and what they're saying to women. And if it's anything like, oh, you just have to deal with it, whatever the problem is, or this is normal, I'm like, nope, not doing it. So I think like having the integrity to stick to your guns and trust that is something that I've learned over 6 years, because I didn't always do that in the beginning. Like, I just wanted everything, and so, like, I didn't say no to anything, and, like, I just feel like it kinda, like, went off the rails a little bit, but, I think being a lot more selective and, like, just trusting that, like, you have like, the fire and the message and, like, stay there. Like, stay with that. Like, remember why you're doing it, what you're doing it, who you're doing it for, and it's, like, whatever you pick, staff, clinic, product, logo, if that doesn't, like, directly serve those 3 things, then, like, don't do it.
Yeah, that's great. That is that those are good sort of principles to stand by for sure. I like the one that if you wouldn't use it, you're not going to, yeah,
Right,
work with
I'm not gonna tell my patient to, like, put something in their vagina if I'm not gonna put it in mine.
no, totally. So what would be I'm gonna use the word fringe, but what would be a fringe or an out there idea that you wish would be more mainstream? Right? Is there something that yeah, that you kind of are like, "Oh, I wish this would be yeah, more mainstream."
I mean, everything. And I feel like everything that we're doing, I mean, I wish a lot of things. I wish when somebody is pregnant, gets pregnant, that they are introduced to pelvic floor physical therapy, that um, insurance covers prevention of injury, that we don't have to fight for our diagnosis codes as not being considered medically necessary by insurance companies. I wish that in every single person that had a baby that was in the hospital for postpartum on the mom and baby floor at least got a visit by inpatient PT. I wish that there was outpatient PT as part of the 6 week, 4 week follow up, whatever the case may be. I wish a lot of things. I don't think we need to force any sort of treatment or intervention on anyone, but I would like them to have the choice. And I
I
would like,
completely agree. Just the exposure. I think one session, like your family doc for us in Canada, but our family doctor refers us to,
yeah,
OB or a midwife. I would love it to be that referral and a referral to a pelvic health physical therapist just for a session. And then you can, at least you've had the exposure and same thing postpartum, right? Even just one session to be a part of the team. So yeah, those are all really good wishes, if you will, right? Do you think it's just a matter of time before that's the case? Or do you think this is going to be, I'm going to call it an uphill battle forever?
yeah, I think both. I mean, I certainly hope it will be the case. I certainly hope some of it will be the case by the time I'm ready to, retire and not work anymore, which I feel like will never happen, but that's another podcast. Um, I think it will be an uphill battle. Well, I know it is an uphill battle now. So I am hopeful. I think there is a lot more momentum towards women's health right now, especially with like the menopause, perimenopause stuff. But I think like we can't ever assume that anything is going to be easy or handed to us. So I think it it will take a long time, but I think it's going to change.
Yeah.
I
I
do.
think it does, of course. I mean, that's why you're doing or I'm doing the work that we're doing to bring awareness to everybody, right? And help more people for sure. So, what's one thing that you would say to or would like to say to like every woman before she gives birth? What's the one thing,
Before,
just one thing to say to all women because they might not be, receiving care or what have you? What would it be?
gosh, like how do you even like put it into like one? I think
Two things too.
yeah, I think it would be like something along the lines of there are no absolutes and there are no like there is no perfect or right or wrong way to have a baby. And I think in the early stages of trying to grow your family and getting pregnant, that there's a lot of information that's like very hard to navigate through. So, like, do a little bit of do your due diligence, understand that there are some things we can't control because one doctor or healthcare provider or PT or somebody says one thing doesn't mean that it like all has to be like that. And we everything is figure outable. Like we can figure it out even if it's been a while or an injury's been there for a long time or you're nervous about it. Like we can figure it out in a way that is acceptable. So I don't know. I don't know if that really came across like as clear as I wanted to be, but I just want women to know that, like, there are options, I guess.
Yeah, yeah, there's no one absolute. Like, I like that for sure. And then same question, what would be sort of the one thing that you would want to say to the system? Not to the woman who's giving birth, but to the whole, I'll say birthing, I'll say system, that process.
Well, it's a profanity, you know, like, it's I mean, I think just, like, let us in, you know,
Yeah.
give us the seat. Like, we are here as a qualified team member that only will make care better for patients. Um There's no reason that we should not be as involved in obstetric, gynecologic, reproductive, osteoporotic, menopause, adolescence, female athlete. There's no reason that we should be excluded from the care team. And we need to, they, we need to start to make it more of a standard along with these like timelines, like periods, sport clearance, physicals, sex stuff, pregnancy, marriage, all the things. Like we need to be in kind of all of those life phases. And we shouldn't have to like fight to get in there.
Yeah. I love that. Let us in, essentially. Totally. So in the work that you're doing, what's the hardest part? What's the thing that sort of still gets to you? 'Cause we've just talked a little bit about advocacy, but would you say that that's one of the hardest things?
Um, I think, I feel very lucky right now at this like present time. There's a group of OBs here that I have a wonderful relationship with, and they are very supportive of the work that we do. And they defer to me a lot for like my thoughts on things. So right now in this town, I feel like the advocacy piece is like going, which is great. And I have a really wonderful working relationship with these providers, which is awesome because like the people that benefit from that are the patients, which is what we love. The thing that's hard for me is I'm only one person, and I wish that I had more time, space, less barriers, more therapists, so we can help more people. And it's still hard for me after 16 years to hear some of these stories and experiences from patients. I've heard a lot of pretty upsetting things. As I'm sure you have too. Um, throughout the 16 years that I've been doing this. And I still am like heartbroken over some of them, and that I hope actually doesn't change for me. Like, I hope that I always feel connected and, like, emotional about it because I don't wanna stop what I'm doing with it. I hope what happens is that the stories stop
Yes.
because
Yeah.
it's different, but, like, until the stories stop, like, I wanna feel that with my patients, but it's hard. I mean, it is hard.
So then is your app like the goal of that to help change that, right? Because as you said, you're only one person, one set of hands, etc. Speak to me about a little bit about the app and how people can find it, find you, but what the intention is there.
Yeah. So the way that the app is set up is I have 2 tracks. I have, like, a pregnancy and a birth track, and then I have, like, a postpartum recovery track. So within the pregnancy and birth track, there are 3 courses, if you will. One is, like, on birth prep injury prevention, one is for partners, and then one is, like, early acute recovery. Like, what happens in this, like, very kind of sacred time period for tissue healing. The postpartum one starts ish at like 6 weeks post. So, like, once you're cleared, we're doing exercise, kind of like a patterned rehab specific motor control, proprioception, like the early stages before we go back to like running exercise, that sort of thing. Then I have a return to sex in there that's like all about return to intimacy. And then there's a return to running course. So, like 3 in each. So, my thought with the app and, like, my the genesis behind it is to provide, and this is what I say to my patients and them too, is to provide the data and the information and through the lens of, like, injury prevention, expectations, evidence, and, like, physiology. And to give the people that are having babies and families that are having babies kind of like all the scenarios. So they can create like an algorithm or a decision
Yeah.
making tree based on these scenarios. So like I'm not going to say in the app, you do XYZ to not tear, or you're doing XYZ to not get induced. I'm saying like, okay, this is what an induction looks like. These are the reasons for induction. These are the questions that you need to be asking ahead of time with your providers at these appointments. Once you have that information, then you decide what you want to do with it. And I have gotten like some physicians have like sent me DMs on Instagram and they're like, you're scaring women and you're fear mongering and you're fear based education. And I'm like, I'm actually not, because you are doing, like, in my opinion, not providing the data and the information is doing more harm than
Mhm.
provide data information. And I was like, they can handle it. Like, women are strong.
Knowledge is empowering, right? So it sounds to me like you're providing all of the knowledge, all of the education, all of the statistics, etc., so people can then make an informed decision,
It's
right?
not that crazy. It's
No,
really
it's
not.
sounding pretty good to me.
Yeah, it's really not that crazy, and it's like, okay, what are your episiotomy rates? Like, what
Yeah.
has to happen in the decision-making tree to go to the next intervention? Like, what are all these variables that we have to look at? Because, like, so many people come in, and I know you probably experienced this too, where they're like, "I have no idea what happened. I had no idea. I had no idea what they were doing. They didn't tell me anything. Next thing I knew, they were cutting me. Next thing I knew, there were forceps. Next thing I knew, I was going to C-section. Like, no clue, no idea, nothing. No idea about meds, about options, about positions, nothing.
Yeah.
And like, I don't want that. I don't want that. I want you to know so you can decide what works best for you in that moment. So the app is really designed to give people that information. I teach in the app injury prevention strategies, movement and exercise, and birth prep to reduce the risk of the higher degree tears. I never say 100% we're going to not have a tear if you do these things, but like, here are the goals. And if you have a fourth degree tear, this is what it looks like. This is what we have to do in the early stages. This is when you come back to PT. This is what we expect healing wise. This is prognosis. This is what we expect for the next baby. So it's like, if there's a fourth degree tear, they're not like, oh my God, I just tore into my asshole. It's like, okay, I tore into my asshole. I know what's going to happen.
Here's our next step.
Not my first choice, but
Yeah. Yeah.
like it's okay. Like, we're going to figure it out. So, yes. So I guess long story short is that like the app is designed to give actual strategies for tissue protection, injury healing, mechanics, physics, just like we would do for an ACL, just like we would do for soccer players, because we know soccer players tear their ACLs at high, women soccer players tear at higher rates. So what do we do to prevent that? Same thing for delivery. What are we doing to prevent these higher level injuries that have more long-term problems? Not prevent tearing 100%, but like, how are we minimizing risk to the pelvic floor that we know has long-term outcomes that are not favorable physically, emotionally, financially, socially, all the things. Like, we need to be preventing that. There's this great study that came out that talked about in my TED talk, actually, that said like pelvic floor injury and birth injury is the single most um devastating musculoskeletal injury or something along those lines. I'm not quoting it correctly, and it's preventable. And so, like, there is no reason why we can't be working to prevent it from a musculoskeletal standpoint. So that's really kind of like the app and then the recovery piece.
That's amazing. I wish this was more available when I had my first, right?
I know.
We all do, right? I
Yeah.
have to reflect experience. Oh my gosh, right? But
Yeah.
I love it and thank you for creating it. You're gonna help so many people, right?
Hope.
So
I hope. I
Marcy,
hope.
for people that are looking to find out more information about you, your app, your clinic, all of it, where can they find you?
Yeah, everywhere. The app is yep. The app is on the App Store and Google Play, so it's good for, any smart device. It's called Down There Doc, the app. Um, it's a pay what you can model, so I wanted to, take away the barrier of very expensive, like, high cost, education. So there's 3 options that you can pick, whatever works for your budget. Um, and then but like, website is downtheredoc.com, Instagram, TikTok, Facebook is all Down There Doc. My clinic is in Alabama, and I have links to it all over social media, and my website as well. And then same thing for like blog and newsletter. And if you want to get on the email list, just go to the website, all the things. So we're kind of like revamping a little bit of the content. We'll be putting out like a free version, kind of mini version, and then you can get into the app after you go through that. But I am one person with single mom with kids and like trying to get this clinic up and running, and the book is due in 2 weeks. So I'm like a little bit behind on some of my deliverables, but we will get there. We will get there.
Beautiful. I love it, Marcy. Well, thank you so much for taking the time. Obviously, you have a super busy schedule to chat with us today. It's been an absolute pleasure. Thank you.
Thanks. Thanks for having me. Loved it.
Thanks.